I will be performing an intramuscular injection to my patient, but first I will make sure that the scene is safe, free from any spillages, cords, cables, and clutters that may pose risk to me, my patient, and others. Once the scene is safe, I will do my hand washing according to WHO standards, adhering to the 5 moments of hand hygiene, which is before and after touching the patient, before aseptic procedure, after touching body fluid risk exposure, and after touching the patient's surroundings. I will do this for 20 to 30 seconds, applying a handful of product all over my hand. Rubbing palm to palm, back of my hands with fingers interlaced, palm to palm with fingers interlaced, back of my fingers interlock, rotational rubbing of the tips of my fingers against my palm, rotational rubbing of the thumb, and rotational rubbing of the wrist. Once my hands are dry, it is now safe to approach my patient. Hi, how are you? My name is Belle. I will be your nurse for today. How do you prefer to be called? Oh, that's a lovely name, Emma. Can you see and hear me clearly? Are you warm enough? Right, that's good. Is that alright if I close the doors and windows to provide you some privacy? Closing the doors and windows. Do a quick hand rub. Emma, can I just check your full name, your date of birth, and your address, please? Alright, that's all the same with your notes. And have you got any allergies at all? Alright, it's also noted in your notes. Alright, Emma, I am here today to do an intramuscular injection. So this procedure involves a needle, but don't worry, I will be gentle as possible. Alright, because I'm giving you a medication via intramuscular injection. It is a hydroxycobalamin. Have you had one before? Alright, that's good. Again, this medication is to treat your vitamin B12 deficiency. And you may experience some tummy upset later, or also soreness on the injection site. Alright, but don't worry, I will be monitoring you for the next 60 minutes. Okay, just to let you know, we got 4 different sites of injection. So you can have it on your arms, on your thighs, on your hips, and on your buttocks. Where do you prefer to have it now? Alright, that's good. Okay, I will give it on your upper arm. Do you prefer it on your right? Is that alright? Okay, that's good. Emma, is this the right time to do it? Alright, and are you happy for me to do it? Okay, thank you, Emma. Can you just give me a minute? I'll be just in the other room and I'm going to prepare our materials and the medication. Alright, thank you. Just give me a shout if you need anything. Now I am going to prepare my materials. I have here my tray. It's clean, dry, and intact. It's safe for me to use. A hand gel, clean, dry, and intact, expires 2024. A box of gloves, clean, dry, and intact, and expires 2025. Sharps bin, dry and intact. I can open it 3/4 and close it 3/4 after use, and it is not past the warning line. Aspirating needle, clean, dry, and intact, expires 2025. Injecting needle, clean, dry, and intact, expires 2024. Syringe, clean, dry, and intact, expires 2023. 2 alcohol swab, both clean, dry, and intact, and expires 2023. Cotton balls, I will make sure to get it from a container which is not past expiry date. And plasters, clean, dry, and intact, I'll make sure I'll get it from a container which is not past expiry date. And my medication, hydroxycobalamin, 1 mg per ml. I will counter check it with the patient's prescription. Intramuscular injection, 1 mg per ml, to be given today, signed by this prescriber. Before giving any medication, I will make sure that I adhere to the rights of drug administration, that I got the right patient, the right drug, the right dose, the right date and time, the right route and method, diluent if applicable, and also recheck the allergies of my patient. I will also make sure that my prescription is valid, legible, signed by the prescriber, and with blip number. If any of this is missing, I will not give the medication and inform the prescriber. And if there's something that I am unsure of with the prescription, I will consult the British National Formulary. Now I'm gonna prepare my medication. I'm gonna wear my apron, making sure that the clean part is facing my patient. Hand rub. Wear my gloves. First, I'm going to clean the ampule using the alcohol swab. This one to the domestic waste bin. I'm giving it a good clean and allow it to dry for 30 seconds. Get the cotton ball. Open the ampule away from me and my patient. If this is a glass ampule, I will make sure to throw it in the sharps bin. This one to the domestic waste bin. I'm gonna prepare my syringe. Open my aspirating needle, making sure not to touch the key parts. Connect them. Domestic waste bin. Check for functionality. I'm now going to withdraw the medication. Withdrawing the medication, 1 ml of hydroxycobalamin, bevel up and eye level. Recap using scooping method. I'm gonna remove the bubbles if there's any by pulling the plunger down and up and gently tapping it. I'm gonna change to my injecting needle, making sure not to touch the key parts. The needle goes to the sharps bin, wrappers the clinical waste bin. Assessor, this is my medication for my patient, 1 ml of hydroxycobalamin. I'm gonna remove my gloves, throw in the clinical waste bin, quick hand rub. Now I am going back to the patient. Making sure again to close the doors and windows and assist the patient in a comfortable position. Hello, Emma. I'm back with the medication. Are you comfortable? Alright, that's good. Is that alright if I do a second identity check before we proceed with giving your medication? Alright, can you tell me your full name, please? Yes, and also your date of birth. Alright, that's good. It's Emma Smith and 1901-1974. Can confirm that I still got the right patient. Now I'm gonna assess the site. Is that alright if I roll up your sleeves? Alright, thank you. Alright. I'm gonna measure it. So it's 3 finger breadths below the acromion process. Make a letter V. The middle will be my injecting site. Hand rub. Gonna wear my gloves. Before I give the medication, I will make sure to clean the site. Domestic waste bin later. Emma, cold wipes coming. I'm gonna clean it for 30 seconds. 1, 2, 3, 4, 5. And allow it to dry for 30 seconds. 1, 2, 3, 4, 5. I'm gonna get a cotton ball, place it in between my fingers in my non-dominant hand. Emma, I'm going to give you your medication now. I'm gonna stretch the skin. I'm going to inject it in 90 degrees angle in a dart-like manner. Sharp scratch coming, leaving 1 centimeter of the needle showing. I'm going to inject the medication for 10 seconds per meal. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And leave it for another 10 seconds for absorption. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rapidly withdrawing it. Applying a gentle pressure without massaging the area. Activate the safety lock. Emma, there's no blood. Okay, that's good. Do you want some plasters on? Alright, there's your plaster. Can I roll down your sleeves? Alright, Emma, we're done in giving you your intramuscular injection of hydroxycobalamin. Have you got any questions for me? Have you got any concerns? Alright, that's good. I will be just in the other room doing my documentation and also doing my aftercare with the equipments that I have used. If you need anything, just give me a shout and I'll be happy to assist you. Alright, thank you. Now I'll do my documentation, removing my gloves and throwing it to the clinical waste bin. My name, my signature, the date and time. For my aftercare, we'll make sure that everything that touches the patient will go to the clinical waste bin, including my gloves and apron. All wrappers and other rubbishes will go to the domestic waste bin. Sharps and glass ampule will go to the sharps bin. And the tray will be cleaned and disinfected for the next use. And other materials and equipment will be returned back in the right places.